So pheochromocytoma and vascular endothelial growth factor, what is the relation between these two? We know that VEGF and pheochromocytoma is closely related, and modern targeted therapies are now focusing on this, especially in metastatic disease. So when we think about pheochromocytoma, as in every tumor, angiogenesis is the cornerstone in the proliferation of tumor as well as its metastasis. So vascular endothelial growth factor helps in angiogenesis and hence tumor proliferation, especially if there is hypoxia. So we have mainly two types of vascular endothelial growth factor, that's 1 and 2, and which binds to VEGF receptors, also called VEGFR. Among the vascular endothelial growth factors, VEGF-A is the most important one, and it's the most characterized angiogenic factor, and it binds to two types of receptors, that's the VEGFR R1 and R2. And the role of angiogenic markers in pheo is not that well known. So the VEGFR, the vascular endothelial growth factor receptors, the VEGFRs, are typically tyrosine kinase receptors. Actually, these are the TK receptors. So VEGF-A, when it initiates a signal of cascading events that involves activation of MAPK and PI3K. So pheochromocytomas are well vascularized tumors, and the upregulation of VEGF-A is quite important in these tumors. Also, the VEGF-A expression and the microvascular density, the MVD, in these tumors have to be are found to be significantly increased, especially in malignant tumors. So there is a relationship between VEGF-A and malignancy. So what is the application of this to the pheochromocytoma? Pheochromocytoma, the surgery is secure, but in metastatic disease, when surgery is not possible, we try for other alternatives like chemotherapy and radiotherapy, which is of very, very limited value. I mean, it doesn't produce much. It is not of much help in these tumors. So the diagnosis of malignancy is quite difficult in pheochromocytomas because, as per the WHO, malignancy can be only detected when there is metastasis to non-chromaffin sites. So this is where the importance of the VEGF-A lies, like whether it's a potential marker for the malignancy in the future. Well, that's more under research, and that's more under debate now. Studies have shown that there is moderate to strong expression of VEGF in malignant pheochromocytomas and weak expression or nearly no expression in benign pheochromocytomas. Thus, low VEGF expression in pheochromocytoma favors a good prognosis. So, protein kinase inhibitors are now, in fact, targeted against the VEGF. So, sunitinib has been found to induce partial or complete remission in patients with paragangliomas and malignant pheochromocytomas. Patients with hereditary form of pheochromocytoma showed overexpression of VEGFR1, which is important, and whereas in sporadic pheochromocytomas, there is a higher expression of MVD, so microvascular density. So that needs to be noted. Also, pheos with SDH mutations and VHL mutations have shown an increase in angiogenic molecular expression. So this forms the basis for targeted therapy and also for the diagnostic for diagnostics of potentially malignant tumors. So increased expression of VEGFR receptors may suggest malignancy, and targeting of these molecules and the receptors may promise remission or cure in the future, especially in case of malignant pheochromocytomas.